I'm going to share this absolutely fantastic case with you, which Antonina Kalmykova showed me, and it really is an amazing case. I'll tell you now that it's a balloon cell melanoma, so you don't have to think about it too much, but it's the best one that I guarantee you'll ever see. And the interesting thing is it's a primary tumor arising in the skin. And you see this very thick dermis. That tells us the biopsy has to come from the back, because that's the only site where the dermis is that thick without any significant large numbers of hairs. So back skin, and I know it's an elderly patient, and we can see two nodules, and there's a bit more of it below. We can see it at the edge between, and at the edge there's something going on in the epidermis. So let's have a look at this, and we'll enjoy it in more detail. Let me just get to the top. So there is, there's the first bit that we want to look at. And isn't that just so good? Balloon cell melanoma, more of it there. And there's epidermal or junctional activity on the side, in the middle, and this edge over here. And we'll look at that more closely. It's rather nice because there's melanoma in situ, and it's showing balloon cell change. That's not something you see very often. Now, I always teach that balloon cell melanoma is much more common than balloon cell nevus, and I think that's true. And so if ever you're tempted to diagnose a balloon cell nevus, you've got to look at it very carefully to make sure that you don't miss a melanoma, because the features can be quite subtle. To my mind, and in my experience at least, balloon cell melanoma tends not to show a lot of pleomorphism. You have to look around to find it. And the balloon cells are characteristically, they're pinky and granular, or bubbly, or a mixture of the two. And the nuclei are central, and the nuclear membranes are always very sharp. And you do not see the crenation or indentation that you expect in a sebaceous carcinoma. So I don't think you should be fooled into thinking sebaceous carcinoma, because the nuclear morphology is just different. Here we've got lots of pigment, so we know it's, and we saw the junctional bit, so we know it's melanocytic. But as you'll notice, as I just scroll around the lesion, one's not seeing great amounts of nuclear pleomorphism. And in fact, we haven't really seen anything to get terribly excited about. But if I go down to a lower power and we look at this bit here, this may be a little bit more profitable. I know that the other half, which we'll get to shortly, is really very interesting. But let's have a look. Well, here we're beginning to get a little bit more pleomorphism. There's a pretty big nucleus there, which should alert you to there's something going on. So let's have a look around, and I suppose you could say there's mild nuclear pleomorphism, but it's not something that's going to make your hair stand on end, that's for sure. I won't spell that. There's a possible mitosis there. Sometimes mitoses are hard to tell from degenerate pyknotic nuclei, and so one has to be a little bit careful in what you do accept as a mitosis and what you decide probably isn't. There's some variation in the cell size. I think that's for sure, but some of them are huge. But I'm not sure whether that means anything very much or not. I think it probably does, largely because balloon cell nevi that I have encountered have been more cells more this size. So when you get a thing, cells that are that big, and that's quite a big nucleus with a big nucleus, I think that probably is genuine pleomorphism. But let's go back to the ×2. Now I've got to find, this is the bit that I really want to look at, and we'll turn that one around because this one's jolly interesting. I will look at that junctional component in a minute or two. I haven't forgotten. But let's look here because this bit's quite interesting. You see, there's obvious balloon cell change there, and on the right it becomes much more. I suppose actually I should be saying much less balloon cell. That would make more sense. The cells are rather small. They're basophilic, and this could be. You certainly would, sebaceous carcinoma could enter the differential diagnosis. Now this is the sort of thing that you see I have problems with. If one looks at this field, there are lots of possible, there's a possible mitosis, there's another possible one, there's another possible one, there's another one, there's another one, there's another one. All of those might be mitoses, but I'd like to find some, ones that are completely for definite, and I know there are plenty in here. I just need to go down slightly in the magnification to see where I am, because I've looked at this slide many times, and so I have a rough idea of where the mitoses that I'm looking for actually are located, because there are some nice, there's a nice pleomorphic nucleus there. See, I think that's probably a mitosis, but there are more convincing ones. You just have to be very patient and gaze at the screen just as I am and get bleary-eyed, hunting for mitoses. It's a bit like hunting for acid-fast bacilli. No, there's one there with, I think that's a genuine mitosis. And this is where the obsessive compulsive nature of most pathologists comes into value to us, because it's always much easier to find things when you're not looking at it for a video. And unfortunately, the one thing you can't do with scan slides is sort of dot them in advance. At least if you can, I don't know how to do it. Well, I hope I've shown you enough possible or definites that I have you convinced. There's one there. There's another probable one there. That looks like a mitosis there. We'll just spend a little bit more time just for completeness sake. It would be nice to... Actually, when you look at this field, you can see that there is, I suppose you'd call it subtle pleomorphism. It's a bit like subtle pleomorphism in a nevoid melanoma. The more you look at it, the more you pick up. You see, there's a big nucleus there. There's another one. And over here, the nuclei are somewhat pleomorphic. So I think I'm grinding. My energy level is grinding. Oh, there's a nice one there. So, and see, those are possible mitoses. It's hard to be certain, but that's a definite one there. So we found a number of definite mitoses and a few potential mitotic figures, but really in the context of this, a couple is more than enough. Now I'm going to go back to ×2, and then we'll look at the other. Whoops, I think you have to go this way. I want to just show, yes, I just want to show you this this junctional bit because it's quite nice. It's quite interesting. You see, there's the melanoma that we've been looking at. There's the junctional component in the adjacent skin, and you can see that the tumor is arising from junctional activity, and in fact is showing balloon cell change in the in situ component. So that's quite something, isn't it? So that's really all I have to say. It's just a beautiful example. I hope you enjoy it, and it's the sort of thing you need to have a look at quite a few times because it's a great way to enjoy melanocytic pathology. There's the middle bit that I was going to show you with more junctional activity, and here we've got the odd balloon cells scattered around in the adjacent epidermis. So there you are. A perfect balloon cell melanoma. So thank you very much for your attention.